Our guest for today is a doctor, a trained public health specialist with 7 years of experience. She has worked in areas of primary care, epidemiology, biostats, health research, health system strengthening, public policy drafting, monitoring and evaluation of health programs, capacity building of healthcare workers, teaching and training of undergraduate, postgraduate, and interns, a recipient of various awards like Proficiency for Surgery, Best Postgraduate Student, Best Original Article for Lung India Journal, and Best Paper Award in international conferences, with 5 publications and various presentations in conferences at both national and international level. Currently, she designs various strategies for risk communication and implementation of healthcare program as Senior Program Manager at Doctors for You. Please welcome Dr. Shweta Arora.
Thank you so much. The boundaries should not stay till mass media because health communication is beyond that. It's very broad concept. Health communication is basically, we say there are no single theory that dominates health communication because the health problems and the populations and the culture and context, they vary. Why I say this? Because when you talk of healthcare problems, we are not restricted to the COVID thing, because now health has become a big issue. Why? Because now we're going through a pandemic, which has become like the life-threatening thing for all of us. Many of people who have lost their family members, sorry for them. So it's not just restricted to the pandemics like COVID. It may be the healthcare problems. They may vary from places to places, from population to population, and from different populations. When we talk of different populations, populations can be understood in the terms of the ages, like if the children will have different issues, adults, adolescents will have different issues. Gender wise differences will be there. Males may have different problems I'll share an example how cultures affect, how the socio behavioral aspects come into being. So the culture there is that the females are never taken into the hospitals, home deliveries occur, maternal deaths are very common, children die very easily because they say it's okay, we can have another one. That's the thinking. Even if we give the healthcare to the doorstep, it becomes an issue because the culture or the socio-behavioral concepts are like that. It has been there since ages. It's difficult to change. So definitely it does have an effect on health. And when we are communicating the same to those populations, it will vary from one population to another. So we have to keep all these things in the mind while we are designing any kind of health communication program. So what is health communication? It's a study in the use of communication strategies to inform and influence individual and community decisions that enhance health. So when we talk of communication strategies to inform and influence, why can't we say just change them? So health is never one concept where one decision can just be given like a law. No regulatory thing can be done. You can just inform people. You can give them informed choices. By informed choices, I mean that you give them the options which are available to them. You tell them, look, if you want to prevent COVID, okay, wear the mask, wash your hands, take the vaccines, and all of these have to be done. But at the end of the day, people will choose what they want to, depending upon TB. I remember Amitabh Bachchan giving that TB के लिए इतने सारे messages he was giving. But at the end of the day, it's not just one-liners which are related to it. It is based on a lot of research which has to be done. And the research should be completely evidence-based. It's not simple just going and reading 2 or 3 newspapers or getting some previous written history, something like that. With health, every day there is a change. Every time there is different data sources which are telling you, okay, there is a change, there is a different medications. Even for the COVID, we have seen there is a lot of change from the start. When it started, it was there was no medication or the vaccine available, and the cases were less. We never knew what is known as the Delta variant. We never knew what are the symptoms. We never knew what is the incubation period. So eventually everything built upon certain research which was done in certain number of the cases which were there. Okay, so what is the scope of health communication? Where all can you reach through the health communication? It tends to increase the intended audience's knowledge and the awareness of a health issue, a problem, or even a solution, influence the perception, beliefs, and the attitude that may change the social norms. Now, when I talk about social norms, I also discussed earlier, like they have biggest effect on taking up the healthcare. Even if we provide the healthcare, if the society or the social norms are such that it is not allowed by them, they won't take it. Then health communication helps the people to take a prompt action, demonstrate or illustrate healthy skills. Healthy skills can be simple things like doing brush twice a day, which is shown in the TV, washing your hands, we have seen with the Lifebuoy ads. Then reinforce knowledge, attitudes, or the behaviors. It can show you the benefit of the behavior change, advocate a position on the healthcare issue or the policy making. Then it can increase the demand or support for the healthcare services. Then health communication refutes any kinds of myths and misconceptions. So this is the high time which is required during the COVID. We have seen the infodemic, not just an epidemic or the pandemic coming, the infodemic which has come through the different social media networks. Then strengthen the organizational relationships. How we can combine, once you combine the other strategies with the health communication, you can also achieve something like it can cause a sustained change in the individual will adopt and maintain a new health behavior, or the organization adopts and maintain a new policy direction. And it can overcome the barriers and the systemic problems such as insufficient access to care. Suppose you keep saying wear mask, wear mask, wear mask. But when there was no availability of the mask, how can people wear mask? So until and unless you provide them with that material which is required, so that is the thing which is required, or the care. If you keep asking them, okay, you are pregnant, go to the hospital, show whenever there is a pregnancy, go and show it to the hospital. But until and unless there is no nearby hospital, there is no person to accompany a pregnant female, how can you ensure that the female will go and just have the delivery there, until and unless she has an access to care? So I will be talking of access everywhere. You must understand, access is not just restricted to the availability of the healthcare anytime. It is involves so many other concepts. So access can be one, the healthcare should be available, should be quality healthcare so that the people, what they want, they are able to get it. Thirdly, it also involves that the healthcare is available on time. We have seen in the hilly area, somebody who's staying very high up, there is no hospital, has to come down, which is a time consuming process. We may lose the patient during that time. So the timely healthcare. Another thing is the access can be, the barrier to the access can be the cultural norms, as I mentioned. So the cultural norms can be tagged upon at times. So that is also a barrier to the healthcare. So if you have to prepare a good communication message or the health communication program, these things have to be kept in mind. Although we will be discussing all this in more detail, it's just a small gist of it. Then communication cannot compensate for inadequate healthcare or the access to the healthcare services. As I mentioned, if you keep telling them what to do or wear the mask, if you don't have it, nothing helps. Produce a sustained change in the complex health behaviors without the support of the larger program of the change. So when we say that we have to bring the change in the behavior of the people, it is not just through the IC campaigns. Only IC campaigns, giving them the mass media, talking about it doesn't bring change. No. Another thing which is required is an enabling environment. Then communication cannot be equally effective in addressing all the issues or relaying all types of messages. So only communication, you cannot address all types of issues. Many a times there are other methods, like behavior change communication, which has to be particularly one person oriented, or the counseling has to be done continuously for single person. So all the issues cannot be discussed in front of the public, and that cannot be tackled. Now it reaches to the individuals, to groups, to organization, to community, and to a larger part of the society. Now, health communication campaign, for any health communication campaign to be successful, first of all, we always define the goal effectively. So
Thank you.
goal, when we talk of, it's a very broad aspect. We say that goal is nothing but the end point of all the activities reached to a goal. Then when you talk of objectives, they will be very specific and time bound. And when we talk of targets, will be smaller activities to be done to achieve to that objective. And strategies are the activities which we design. So I'll give you an example. What is the goal? So in any case, when you are designing any kind of the communication campaign, you have to identify the larger goal. The goal could be, when you design, suppose a campaign you are designing, okay, I have to educate the people regarding their lifestyle changes or the lifestyle uh, 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 diseases. Suppose you have to educate them. The final goal is no one in this uh, area should be having obesity. The final goal is that the objective you will design, okay, my campaign should, by the end of the campaign, 80% of the resident of this area will be informed about what to eat, what is the right choice to eat. And then your target will be, suppose, by the end of like this month, every monthly, at least 50 residents will be given the choices of right eating. So something like that. I'm telling you a very crude concept, but eventually it turns out like this. So you have to identify a very large goal and determine which part of the larger goal can be met by the communication campaign. So when we design, healthcare programs or any other programs, not just the communication, at times the social marketing thing comes into it. So what is social marketing? If I have to tell you in a broad concept, it's like the product is there, a product which has, it's normal, it's usual, like you do a product marketing, you tell the people, okay, this is good, you buy it, okay, it will be helpful to you. But in case of the healthcare or the social marketing, when we talk of, there are certain behavior change communication which is involved between. I'll tell you, I'll share an example. The condoms were kept everywhere in the kiosk so that the people can just put the coin and take it out. Why? Because people are very shy to buy them. So you're trying to generate a demand through of the product by marketing it in a manner that it is easily accessible to the people in the right manner, in the right time, in the right choice, in the right place. So the place is like people can easily go and take it. They don't have to ask for it. So there is no shyness or the behavior which stops them to get it. So at times when you're trying to develop a communication campaign, you have to see a part of it can be communication campaign, a part of it can be related to the product or the social marketing or any other objective as well. So when you're talking of the goal, you have to describe the specific objectives of the campaign and integrate these into the campaign plan. Then define the intended audience effectively. What do we understand by intended audience or the target audience? Anyone? You guys must be designing certain media campaigns. If I have to ask any one of you, how do you guys define who is the target audience for your media campaigns? Have to identify the group and consider identifying then subgroups, then learn as much as possible about the intended audience, their beliefs, their current actions, social and the physical environment to the demographic information. Now, create the messages effectively. Brainstorm the messages that fit with the communication campaign goal, intended audience. Identify the channels or the sources that are considered credible and influential, and consider the best times to reach the audience. Prepare the messages accordingly and select a few messages and plan to pre-test them. I will talk them in detail, definitely. But then whenever we try to prepare any health communication campaign, the first part is to know the single message, what we want to give. Bacche do hi achhe. But then one liner is giving you so much of information. So the health communication campaign is not, but most important part is to design the right kind of the message. Then identify the channels and the sources. So when we talk of channels, it could be, we use different channels, whether it's interpersonal communication or the groups communication in terms of focus group discussions. Then consider the best times to reach the audience and prepare the messages accordingly. Then select only a few messages. Don't clutter, don't give too much of information. Nobody is taking the lecture. It is just one liner they will remember, 2 lines or 3 lines maximum, not more than that. Then pre-test and revise the message materials effectively, selecting the message methods that fit the campaign's budget, its timeline. Pre-test them for the people whom you want to share with. Hope they have the similar attribute. So if you are trying to prepare the messages for adolescent, so try and test them to the adolescent age group. Do a pilot testing and then only use it. Then take the time to revise the message and materials based upon pre-testing, because once the message is out, it is out. You can't change it. It becomes the biggest news and it will keep on circulating from one place to another. Then implement the campaign effectively. Follow your plans, what you have created, communicate with your different partners, and begin evaluating the plan. Evaluation and monitoring are a part of it. So this is what is known as health communication program cycle. Although I've touched upon everything from the start only. So health communication for any kind of, when you talk of designing a program, the most important is the planning or the strategy development, planning and the strategy development. Then here it will be developing and pre-testing concepts, messages, and the materials. Then implementing the program, then assessing the effectiveness and the making refinements. The policy change can be brought about by the media. Then technological changes should be there, that a new or the redesigned product, drug, service, or the treatment, or the changing delivery of the existing products, drugs, services, or the treatments. How the technological changes are affecting the healthcare. We have different machines, different ventilators, oxygen concentrator. Oh my God, I was looking at every other person was talking about oxygen concentrator, not even realizing that that oxygen concentrator was of no use actually for the people. We have seen the cases during the COVID second wave, mucormycosis, because the news channel, because the people are talking, infodemic is there of using steroids. Do a good kind of research to find out the right resources and then take it to the people. It's a communication strategy. It's a case study, which is shown for the mammogram. Now, how the communication is done to the doctor can just say, suppose a female goes to the doctor, my doctor doesn't recommend a mammogram. So I'll tell you what is a mammogram. So it's a scan which is done to check the breast cancer, or these days it is more of a preventive scan just to diagnose, even if the smaller changes are seen in the breast, even if there is a start. So the communication can be done to the doctors when that persuade the doctors to give the mammogram referrals to all the women in the appropriate age group. People may have fear about it, that it's a scan, it's a radiological scan, it will affect my body, this and that. So you have to tell them that it is more important and remove her fears. How in the policy change can be brought about through the communication? The person may say, my health insurance doesn't cover mammograms. The policy change can be brought about by the mandating the coverage of the mammograms in accordance with the screening guidelines. Then we talk of defining the objectives. As I mentioned earlier, you prepare the goal, what you want to do, then you have to define certain objectives for the communication. Now, how should the objectives be defined? The objectives have to be very specific. 75% of the adolescents will be informed about the harmful effects of smoking by the age of 19 years. It have to be very specific. Measurable in the sense, today when you have to always see a baseline in case of healthcare. The baseline is people don't know anything about breast cancer. The females don't know anything about breast cancer could be the baseline. And my campaign would be designed in such a way that at least 8 out of 10 women will be able to answer the questions related to the breast cancer, or will be increasing the knowledge of the breast cancer in those females. Then they should be actionable. Don't design the campaigns which cannot be fulfilled at all. A social media campaign for the people who are staying in the villages, no use. Then it should be relevant. If you keep talking of the hypertension while the people are actually having the COVID, no use. So relevant to the time. And timely objectives, that in what time period you will be able to achieve those objectives or not. So these are the things which have to be done to bring the behavior change so that the people use the products or the services for the healthcare which you are providing them. Until and unless you are giving them with the right kind of the behavior change communication, there is of no use even if you give them the products. Now define and learn about the intended audiences. As I mentioned, you have to learn about their age, sex, family size, the healthcare problems, its distribution, whether it's there more in particular states, in certain districts, in certain villages, in certain tribes. In determinants of that problem, determinants could be in terms of the what is the agent causing the disease. Like suppose in case of COVID, it's the virus. The host is the humans who are the cases. Then the environment is the social gatherings is there, or the travel can be there. So all those are the determinants. Then the at-risk population could be like the case of the healthcare workers. They're more at risk for the COVID. Then migration or the travel, it can also affect certain other diseases, not just COVID, influenza, many other diseases which are affected by it. Then geography, some diseases are particularly present, as I mentioned, like kalas are, because there is the fly known as sandfly, which is there only in Bihar. So the kalas are is commonly seen in Bihar, but it's not there in other parts of the country. Then socio-cultural factors, which are affecting behavioral factors. Moving from the intended population, then you move to the specific population, and then define the subgroups according to the common characteristics, which is known as the segmentation. So from the broader population, that everybody will be watching your program or everybody will be looking at this healthcare issue, is not the right kind of the idea. When you have to talk of the specific population, then you have to be very specific about your target audience. Then you explore the settings, channels, and the activities to reach the intended audiences. We should not restrict ourselves to the mass media. Healthcare communication can be done anywhere. It can be done in any community, through any group, any discussion, group discussions. So in those cases, when we are talking of any communication campaign, it's suppose doing it in the school. So that can be a setting. So you can just teach them in the school during that health communication campaigns can be done. Or it can be done at the work sites. When you tell about these days, it's common, long sitting hours. Now the people are sitting at home. Then earlier, when they were sitting in the offices, hardly any time to go out for a walk. Telling them that, during the office hours, you can take a break of an hour and go for a walk, play some. In fact, certain companies are actually giving them the enabling environment by providing them with the good spaces for the sports. That is always good for the company. It's giving better gains to them, decreases the absenteeism. So you have to decide which place the communication has to be done, and times when the intended audience members may be most attentive, as we already mentioned, and the places where they can act upon the message, places or the situation in which they will find the message most credible. So if you talk of contraceptives in front of all the older people sitting around with the younger people in a normal discussion, females will just get up and go away from them. Young people will get up and go away. It's very common. Indian society doesn't take it. There's a biggest social taboo related to it. So you have to be very much cautious about it. Then explore the channels and the activities. As I mentioned, interpersonal, one-to-one communication, most commonly used by the doctors, healthcare workers, focus group discussions, workshops, role plays, folk music, folk dance, then mass media, as we mentioned, and interactive digital media. Now, the choice of media will depend upon the cost, the most important thing, which is there everywhere, like then the literacy level of the people, which is very important. Now, identify the potential partners. Once you have been known which channel or the media which you want to use to give your information, identify the partners whom you can collaborate with. Its benefit is to access to the intended audience. There is more credibility for your message or the program, because the intended audience consider the potential partner at times to be the trusted source. So if you're trying to, go with the WHO, they will always listen to you, because it say the people say that's coming from a trusted source. When you have partners like fan masala wala people, then why will people take your advice when you're yourself telling have fan masala? So you have to choose your partner wisely. So this is how a plan looks like. When you're planning any health communication program, it looks like this. You'll be writing a name of the program, sponsoring agency, contact person, issues of the problems to be addressed, what is the evidence of the need, why do the program should be developed. Then its objectives, communication objectives, then primary audience, secondary intended audience in priority, then market research plans, how will you pre-test the message, activities and the messages and the materials to be developed. Then how will they be distributed, key task of the resource person, list of the persons responsible doing the task, then partnership, who will be your partners in the organization, in partnership in plan, evaluation plan. And once you have developed the plan, the what will be the strategy, how will you go about it? So intended audience, as we mentioned, objectives, obstacles, you should know for the cultural beliefs and all that, key promises on the single benefit that the audience will experience upon hearing or seeing or reading the objective. Then the media channel you'll be using, openings, what opportunities there is, and creative considerations to be taken in. Now, this comes the most important part, how to develop a good IEC message. Now, a good IEC message is short, as I mentioned, hum do, hamare do. It's accurate, it's relevant, just one line, and it should be consistent to the people, very clear and credible. When we talk of credible, it should come through a source which the people trust. Just asking a celebrity to do an ad for the healthcare won't help. Similarly, if you choose somebody who is like a doctor or a renowned doctor who's there, people know the person, will be a better idea to choose. It should be disseminated in the language of the target audience and should use the vocabulary appropriate for the audience. And the tone may be humorous, didactic, authoritative, rational, emotionally appealing. One-time appeal can be there or repetitive reinforcement. Now you see, simple message, keep washing your hands regularly. One single line tells you about the COVID-19. It gives you a lot of information, okay, but then one line will tell you everything. The World Day for the Prevention of the Child Abuse is not November 19th, it's every day. So it's important that you develop the message which are culturally appropriate communications. Don't give them something which is, they don't accept it in the community. Showing them with a female who's wearing usual Western clothes, but for them it's not acceptable. So there are certain things which have to be taken care while you design your campaigns. Then choosing the type of appeal, then threat or the fear appeal can be used. Decide the material, what material to be developed, and the concept testing has to be done later on. You cannot directly put the society on the gun and say such things. You can tell about obesity. This is not the right way of telling the people about information. Fat kids become fat adults. So this is not the right kind of health communication should be done, that it is taken in the wrong manner by the people. So like this is a small gist of how to develop the TV ad. Like in general, keep the messages simple, similar things which we used earlier, as is shown here, that you select the appropriate approach, you be sure of the words which work, use like positive rather than the negative appeals. Visuals should have only a few characters and try to repeat the main messages. Has anyone, you remember one of the ads done by Akshay Kumar, where he asked the person, who the person was smoking, कि जितना सिगरेट में फूक रहा है उतना का ही अगर पैसा अपनी बीवी को दोगे तो वो sanitary pad ले लेंगे. What kind of appeal it is? We're trying to create a fear or the negative side or the threat appeal which you do doing. Now there is positive. Use the similar money to buy the sanitary napkins because it will prevent the menstrual hygiene disorders in your wife. So even such kind of ads or such kind of messages can be developed where they tell you both the things. Monitoring will be an ongoing process where every day you will be looking at, okay, now you send the message, if any, people are accepting it, how many messages were sent, which media was used, whether the media is working well, whether the people are taking it well. Evaluation will be like more of one-time process. In the starting, you will like to see, evaluate how many what logistics you are having. And in between, you will like to see whether we have reached to the place of the half time or not. Or at the end, you would like to see how much change you have brought into the community through your health communication programs. And all this will help you in program designing and behavior change and strategic results. So you have to define certain indicators. For the input indicators will be like to measure the quantity, quality, and the timeliness of the resources provided for the project or the program. For example, the funding, you'll have to measure the quality, quantity, and the timeliness of the products which you are giving. Some indicators will be the short-term effects of a project. Like there are often changes in the behavior following an intervention. For example, the number of the families who say that they took their child for the vaccination after watching the TV spot on the polio. Impact will be the overall effect, which will you see the long-term effect in the surroundings. For example, increase in the percentage of routinely immunized children in the region following the years of programmatic intervention. What is risk communication? It's the exchange of information and interaction on the threats to the health, safety, and environment. When we're talking of COVID, we are doing a lot of risk communication. So the risk communication and the community engagement, it should be nationally led by the governments and supported by the civil societies in the community. So always remember, risk communication when we're talking of things like COVID cannot be like one size fit theory for everyone. Suppose our NGO is working in different areas. We are working in Punjab, Northeast, in Maharashtra. We're working in the rural areas, tribal areas. But for all of them, we're using different approaches for the communication. For the case of the rural population, what we used was more of the folk media. For the educated people, we started with the social media campaigns.
Hi, I'm so sorry. There was some network issue and I couldn't join that time. From my part, everything is over. Very informative and interactive session. Yeah. Thank you so much.
Thank you so much, Dr. Arora, for educating us this afternoon about public and social, this aspect of public and social medicine.